Today, dental offices locally will be allowed to see patients for more than just emergency procedures. While the stay-at-home order is still in place, patients that need dental work will be able to get care. Kobe Thielen spoke with a dentist at West 10th Dental Group in Coley. Does he view this as a good thing?
He does, Scott. Their offices have already been seeing essential patients for essential services, primarily emergency services. But he admits that it's been difficult to tell a lot of their patients that they can't care for them. He feels like now their hands are untied, if you will. Now, a part of this reopening, he also talked about that it's still very awkward because of this stay-at-home policy still being in place. They recommend patients who are vulnerable to the virus to put off those routine appointments for at least another week. We've heard from dentists who believe the reopening is happening too soon. Some have even asked the governor to hold off. But Dr. Brent Barta says he understands that concern and believes that part of that could relate to personal protective equipment.
It's really not clear what that supply chain is going to look like once the entire dental industry comes online. So that's a concern, and that could be part of the concern of these practices. That are we really is the supply chain really adequate to see the dental industry come online completely? We're not going to open at full capacity next week, and we really aren't anticipating opening at full capacity for several weeks following.
As far as staff safety, Dr. Barta says dentist offices already practice with a high level of protection against a number of infectious diseases. He says the dental industry as a whole has universal precautions put into place back in the 80s. They protect against AIDS, SARS, H1N1, and now, of course, COVID-19. Now, most offices, he believes, are going to self-regulate. At West 10th Dental Group, they already have a plan to change up their waiting room to allow for social distancing and have a gatekeeper of sorts at the door ready to interview patients and take temperatures. Scott, send it back to you.